Hi everyone, welcome to Texoma Medical Center Joint Camp. I am Misty Robbins. I am the Joint Coordinator here at Texoma Medical Center, and I appreciate you joining me for this. So first of all, we've seen a lot of studies that have shown that the more you know about your surgery beforehand, the better your outcomes tend to be. And of course, if you're going through a process like this, you want the best functional outcome. So that's what we're doing here. I'm going to talk to you about why you might have a joint replacement surgery, what you can do before surgery to get yourself ready, what you can expect from your hospital stay, and taking care of yourself after you go home. And of course, we know that you could have chosen any hospital to have your surgery, but you chose Texoma Medical Center, and that is not something that we take lightly. Thank you very much for choosing us. So first of all, why do you even have a joint replacement? Well, of course, it's to replace a worn out joint, improve the motion of your joint, and to relieve pain. Most of the time when I have someone come to me, you have all three of those things going on. And we know it's because that, this is not the first step that you've had. Surgery comes when all other options have failed. So there's other things that you've tried. You've probably tried some pain medication. You may have tried some injections. You and your surgeon have been working together to see if there's anything that you can do besides surgery to help. And probably by this point, you are just staying off of it. You're not doing as much. And that's the point where it becomes a place where that's not really acceptable anymore. It's not really acceptable for joint pain to be affecting you going out and living your best life. And then of course, everyone has a personal reason for getting a joint replacement done. I've heard everything from, I want to ride a bicycle again. I've heard my wife and I promised her that I would take her dancing for her 50th anniversary, and this is what I'm doing. And then most often I hear, I just want to be able to walk and to do my life without pain. So make sure as we go through this process, as you go through this process of getting your joint replacement done, keep that personal goal in mind. Everyone's goal is specific for them and it's important to them. And, we're here to partner with you to make sure that you reach your goal. But, on those days that might be a little bit more difficult than other days, it's important to keep that goal in mind, to know that you have something good in mind. There's a reason that you're getting this done, and we're all working together towards that purpose. So what's going on in a joint replacement? Now, if you are having a hip replacement done, you can look at the first two pictures. If you're having a knee replacement done, the second two pictures are what I'm going to be focusing on. But I'll kind of talk over each of them so that you know what's going on here. Well, if you look at that first picture, that is what a normal hip looks like. This is, you just graduated from high school, you've got your whole life ahead of you. This is what your hip probably looks like. You've got the femur bone, which is kind of your thigh bone. And then you see there's sort of a ball on the end of that femur. We call that the head of the femur. And it fits into your hip bone. There's a nice socket there that it fits into. Now you can see between the head of your femur and the hip bone, there's almost like a space as if they don't quite touch. And if you look over at the knee picture, it's exactly the same. What you're seeing there is the bottom of the femur bone, so the bottom of that hip bone, and then your tibia, which is your shin bone. And again, it looks like they don't quite touch. Well, what you have there is what we call cartilage. It is this nice sort of springy material that adds a lot of cushioning as you're moving, which makes moving easy. And it's also very slippery. So as your bones move against themselves, that cartilage allows them to move easily, move with a lot of slip. For those of us here in this area in the South, we can compare it to, it's like having the WD-40 in your joints. It just makes everything move a lot easier. Now, if you look at those second two pictures, the first thing that you see is that space where that cartilage has been is worn away. So once the cartilage wears down, you have a situation where you're, bone on bone. And I know most of you have probably heard that before. You might even have been using it to describe what's going on in your life. It's bone on bone. But what does that actually mean? Well, number one, bone is not springy. It's not made for that, and it is not slippery. It's a little bit more like sandpaper. It's pretty porous, and as it rubs against itself, it actually is causing a lot of irritation, a lot of inflammation, which can cause pain. And, the more time that goes on, things don't get better, they actually get worse. You're going to wear away more of the cartilage, which is going to be, just making the inflammation and the pain worse. You can even get to the point where you start wearing away the bone surface itself. And so, you've got exposed nerve endings underneath. And even as the bone starts to wear away, it's going to be more and more irregularly shaped, which is going to inhibit movement. So you can see as time goes on, this is not going to get better. This is in fact going to get worse. And the good thing about bringing in a joint replacement is that unlike pain medications, unlike shots, a joint replacement actually fixes the problem that we have going on in the first place. So if you look at the hip bone, right underneath the hip pictures, that's what a hip replacement looks like. The surgeon is going to go in and surgically remove the head of that femur, the diseased portion of it, and there will be a stem that fits into your femur bone, and it'll have that head on the end of it. And then he's also going to use instrumentation to clean out the socket of your hip bone, and there will be a prosthesis set in there as well. The knee's pretty similar. I know we call it a knee replacement. We're not replacing the entire knee, but we're going to be recapping the ends of those bones. So that diseased end of your bone where the cartilage is worn away, he's going to surgically remove that in a way that this prosthesis is going to fit like a glove right there on the end. And that's going to be on both ends, on the femur and the tibia as well. And then between the spaces, so that you don't have a metal on metal situation, which could end up creating metal shavings. Of course, we don't want that. So there's this high quality medical grade plastic piece that's going to go in between the metal portions to create, again, a nice fluid movement. And it's going to take away the pain and inflammation that's caused. So you can see that with a joint replacement, it's not just masking the problem anymore, it's actually fixing the issue. So we want to talk about, as you're going through this process, who is going to be part of your team? Who can you expect to be involved? Well, number one, and most importantly, this is why we have it on top and this is why we have it bold, is going to be you and your coach. Now, I'll talk a little bit more about the coach here in a little bit. Of course, we have your orthopedic surgeon, anesthesia is going to be involved, the surgical staff. You've likely already met the surgeon's office staff, and that includes, whether it's your primary surgeon, if you're going through a clinic in Oklahoma, or the surgeon's office staff, all of them are going to be involved. Possibly a hospitalist. Not every case has a hospitalist involved, but this is the physician who specializes in medical care, specifically in the hospital. So if your surgeon feels like you need someone to manage any other kind of issues going on, perhaps you have high blood pressure, perhaps you have some COPD, other things that your surgeon might feel need some extra attention, they might get a hospitalist involved to make sure that you have all the care that you need. You'll have registered nurses. Physical and occupational therapy are going to work with you every day, starting the day of surgery. Nursing assistants and physical therapy aides will be involved. Respiratory therapy is going to be involved as well. After anesthesia, you are going to be at a higher risk for pneumonia. So we want respiratory therapy to be involved to make sure that we do everything that we can to prevent that. Social workers and case managers will make sure that you have everything that you need for discharge. And of course, your surgeon's office staff most likely has already talked to you about your discharge plan, where you're going to go, whether that be home or if you're going to go straight to outpatient therapy, and what medical equipment you might need. So hopefully that conversation has already been started. And then of course, your post-discharge team. Now we want you to know that you are in excellent hands here at Texoma Medical Center. All of our surgeons specialize in joint replacement surgery. When you come here, you're going to stay on our 6th floor. This is our surgical floor. That means that we have special equipment. Physical therapy has special equipment they keep up here for post-surgical patients. And that also means that all of our nursing staff, all of our aid staff, and even the therapy staff, what they do all day is take care of patients who have had surgery. So from the equipment to the staff, you know that you are in the hands of the experts. We will also, we'll make sure that the joint team is monitoring your care and checking on your progress daily. And then our goal is to get you home with home health within, I know this says 2 days of surgery, but our goal is to get you home with home health in the day following surgery. There might be special reasons why you can't go home that next day, but for the most part, our patients are ready and able to go home the day directly following surgery. And our goal is to get you home where you can be comfortable, where you can heal, and where you're in a familiar environment as quickly as we're able to. Now, we talked earlier about the coach. This is a family member, a friend, a neighbor, someone in your life who is going to help you through the process. Usually when I talk to people, it's a spouse, a child, there have been even family friends, but it's someone who is committed to stay with you and to help you out through this process. Usually it's the person who's going to be bringing you in for surgery. We want make sure that not just you, but your coach is as educated as you are in how to take care of you, because they're going to be the person that's there. I can't come home with you after the hospital and make sure that you're taken care of. So we want the coach to be as prepared as possible to help you out on your journey. If you're watching this video, you can go ahead and share the link with your coach. That way the coach can watch everything as well. If your coach has any questions, please share my number with them. I'm willing to answer their questions as well as your questions. And if you're looking at this and you're saying, I don't really have a coach, I don't have someone that, is planning on staying with me or helping me out, this could be a concern. Make sure you call and talk to me about it, because we definitely want to have someone there at least as a backup plan. There are things that you can do before surgery to make sure that you and your home are ready for surgery. So let's talk about you first. First of all, being physically fit is important and is going to improve your recovery time. And that's definitely what we want. The faster recovery time, the better. So we will talk about some exercises that you can do before surgery. These are going to be pretty easy in your home. They are the exercises you're going to be asked to do right after surgery. So of course, they might be a little harder right after surgery, but right now they should be pretty simple. But it's going to be important for you to go ahead and start those. Starting the exercises now is going to help your body and your muscles know what's going to be asked of you in the hospital. And so whenever we have you do the exercises right after surgery, it's going to be that much easier if you've prepared yourself by doing the exercises some each day before surgery. Now, we want to make sure stop smoking if possible and reduce your exposure to secondhand smoke. If you are a smoker, stop smoking. If you have someone in the home that's smoking but not you, ask them to smoke outside until 6-week mark after your surgery. Usually, your blood vessels have this great ability to expand or get smaller based on what your body needs. When you smoke a cigarette, your blood vessels become smaller and stay that way. And they can stay this way up to 4 hours after you smoke a cigarette. So if you're smoking... So as far as preparing your home for surgery, number one, you probably need to have someone stay with you the first few days. That's why it's so important to have a coach. Now, I've had some people say, well, my coach is my next door neighbor, so they're there if I need them. As long as you have someone close by, that's going to be really important. But having that person there and available the first few days after surgery is going to be important. It's also going to very much look around your home right now. Think about the fact that whatever you're using right now, you're probably going to be coming home on a walker. So that's going to be a lot of extra room. You're going to be a little bit unstable because you're walking different than you normally do after surgery. And then you're going to have that walker that's going to need the extra room. So look around your house, make sure that you have nice wide paths that's going to accommodate that walker. Remove any clutter and loose rugs that you might see laying around. Even if you've been used to the loose rugs before, again, you're going to be a little unstable. You might even tell me, well, I'm already unstable. It's going to be different. And so you're not going to be as used to it as possible. You might think that you can clear it and you might not. It can be a tripping hazard. So go ahead and move that out of the way. Move any kind of cords. Move your furniture around if you need to make sure you have nice wide paths. Just remember where you're going to be. You're for sure going to be going to the bathroom and the bed, the living room, probably the kitchen. So those places that you normally travel, make sure that you have a nice wide path so that you don't have any tripping hazard in the way. Now, if this is just a few weeks before surgery, you're going to need a firm seat with no wheels. A recliner is fine. Some people ask me about that because it rocks, but a recliner is fine because even though it's going to rock, it's going to, for the most part, stay in place. A chair with wheels would not necessarily do that. That's going to be a fall hazard because it can go out behind you. Wherever you sit, if it has arms on the chair, that's even that much better because you can use those arms as leverage whenever you're standing up. Wherever it is that you choose to sit, it's going to be important to have a recovery table behind you. This is just a table where you can put all the stuff that you typically need. That way, you're not getting up and down all the time, or it doesn't get lost in the couch cushions. That could happen to me. So on your table, it can be, you have your lamp, your pain medication, water, hand sanitizer, cell phone, everything that you need right there beside you. You do want to make sure that you have clean linens on your bed the night before surgery, and I'll talk a little bit more about why here in a minute. And then think about preparing meals ahead of time and sticking them in the freezer. When you come home and when your coach comes home, especially if you've all been in the hospital together, you are probably not going to feel much like cooking. So making meals ahead of time, freezing them, that way all you have to do is reheat them in the microwave is going to make things so much easier. And your body is going to feel the effects of that less than if you're not hydrated. And also, if you're diabetic, maintaining a healthy diet is going to make sure you keep those blood sugars under control. Diabetes can have similar effects to smoking. So number one, it will increase having blood sugar high most of the time will prolong your healing time. So you'll have a longer healing time. And again, it increases your risk for infection, which we'll talk more about later. If you are diabetic and you don't typically check your blood sugars, this is going to be a good time to start, because coming into the hospital and having surgery, this is stressful on your body, and high stress can cause normally regular blood sugars to now become elevated. So you want to start checking it at least once a day to make sure that you're staying in the range that you need to be. And you just check it as often as you need to. You really want your blood sugars to be under 150, for sure under 200. If they're higher than that, you need to talk to your surgeon about the fact that your blood sugars are running higher and see what you need to do about that.
So for your home, you want to consider having someone stay with you for the first few days. Look around your house. You know what paths you're going to take. You know that you're going to go home, first of all, on a walker. So you're going to have a little extra width with you. Think about those paths you're going to take through the hallways. You're going to go to the living room, to the bathroom, the kitchen, the bedroom. So make sure that you have nice, clear paths in those areas. Move furniture around if you need to. Remove any clutter. If you have any kind of loose rugs or cords in the way, make sure you pull those up, because they can be a trip hazard. Think about where you're going to sit during the day. You want to have a chair that doesn't have wheels. If it has wheels, then it can go out behind you and cause a fall risk. People ask me about a recliner. That's fine, because even though it rocks, it still stays pretty much where it is. If it has arms on it, that's even better, because you can use the arms as leverage to stand yourself up. Wherever it is that you decide to sit, make sure you put a table next to you. We call this a recovery table. That way you have a place for your water, pain medication, you have a place for your phone, your hand sanitizer, anything that you might need is right there beside you. You want to make sure that you have clean linens on the bed the night before surgery. And you might think about preparing meals ahead of time and freezing them. That way you and your coach, when you've gone to the hospital and come back and you're tired, you won't have to worry about making meals for yourself. You'll have those already prepared.
Think about what you're going to need in the bathroom. You want to have non-slip mats in the shower and outside the shower. After you come home from surgery, you will be able to take a shower. You will have a water-resistant dressing on. You won't need to be taking a bath, though. So make sure wherever you're planning on showering, it's going to be somewhere with a shower and not a bath. A lot of people like to have a shower chair. Just makes things easier. That way you can sit down as you shower. It makes you a little less unbalanced. It's less of a risk for falls. So it can be very helpful. If you do have a shower chair, a lot of people like to have a handheld shower head. That way they can kind of maneuver it in every way that they need to. You don't have to have it. It just will make your life a lot easier. If you might need a raised toilet seat, if that's something for the bathroom. And this is something too, you can talk to your surgeon's office to see what they recommend that you need. You can also talk to me, and I'll talk to our therapist to see what they recommend for your particular needs. Or even some home health companies, if that's the direction your surgeon wants you to go, will come out and do a pre-assessment of your home. And so they can come in and look around and tell you based on your needs what you might need. Now, keep in mind, a lot of insurances don't pay for equipment that's specifically for the bathroom. So a lot of these things might be out of pocket. What I always recommend is that you talk to friends. You would be surprised how many friends and family members might have purchased exactly this equipment for a situation like this, where they needed it for a month and then they don't need it anymore, and now it's just in storage. So before you go out and buy anything, ask around to see if maybe you can borrow something. If you haven't already, you will be asked to come in for pre-assessment testing. They will call you and let you know when the appointment is. It's typically about a week before surgery, because we don't want to do it so soon before surgery that it's no longer applicable once you get there. And we also wouldn't want to do it. We want to give a little bit of time though, so if anything's wrong, we can do further testing if we need to. So when you first come in for pre-assessment testing, if you're coming for it here at the hospital, you will need your driver's license and insurance card, a complete list of your medications as you're taking them right now, and then bring any advanced directives if you have them. So when you come in, you will check in at the big front desk, and they will give you a pager. It looks like a pager you might get at a restaurant that's going to light up when it's your turn. When it's your turn, you'll go check in with whatever place they tell you to, and that's when they'll go over, just kind of pre-register you for surgery. They'll get your name and all of your information. That's when they'll look at your driver's license and insurance card. Once they are finished with the pre-registration part, they will take you back to the area where they do the pre-assessment testing portion. You will have a nurse who will go over all of your information. They'll go over your medications. They'll go over your past medical history. They'll ask you a lot of questions. Once this portion, the assessment portion is done, they will do some blood work, do an EKG, chest x-ray. With everything that we do, we're just making sure that your body is healthy and ready for surgery. With a surgery like this, we don't want there to be any surprises when we come in. We want you to be confident, and we want to be confident that when you come in for surgery, your body is healthy and ready and prepared to go through surgery. Now, if there's anything that comes up, you may require further testing. You may even require clearance from another doctor, maybe a specialty like a heart doctor or something, but we will make sure that we let you know all of these things. And again, everything is to make sure that you are healthy and that we minimize complications to the best of our ability. Now, when you go in for pre-assessment testing, they're going to give you a special soap. This might be called CHG, they might call it Hibiclens. Either way, it is a very high-powered antimicrobial wash that's going to clear any kind of bacteria off your skin. You're going to use this the day before surgery, okay? So, you know, we all have bacteria living on our skin at any given time. That's why we have skin. It keeps it out of our body. But for surgery, we're not going to just cut through your skin. We're going to cut all the way down to bone. So we don't want anything that's been living in your skin to have a chance to creep in. So we'll use this wash the day before surgery. You are going to wash your hair and your face and your genital area as you normally do, but everywhere else, you're going to use the special soap. I want you to lather up really well everywhere, paying special attention to the surgical site, whether it's your hip or your knee, and the places that sweat. So that would be like behind your knee, armpits, neck, places like that. Once you're lathered up, leave that lather in place for 3 minutes before rinsing it off. Now, once you've washed, don't put anything on top of it. No deodorant, no lotions, no powder, nothing on top. This is why earlier I said you want to have clean sheets on your bed the night before surgery, because of course it doesn't make any sense to clean everything off of your skin and then to crawl into dirty sheets and put it right back on. So clean sheets on your bed, clean pajamas. Make sure that you don't shave the surgical site, whether it's your knee or hip, don't shave that area. You want to remove any nail polish or piercings that you might have. And then when you're packing for the hospital that night before surgery, you want to pack loose-fitting clothing and walking shoes. We are going to have you up and moving when you're here after surgery. So you want clothes that can be comfy, and you want shoes that you can move around in. Now, the day of surgery, that morning of surgery, you're not going to have anything to eat or drink. That includes no gum or tobacco. You want to take that same wash and do the same shower again. And I have had people ask me, I'm having surgery real early that morning. Can I just take the shower the night before? Studies have shown that it's at least 2 showers together, one right after the other, that provides the most benefit. So go ahead and take that shower the morning of. I know it's early, but it's going to be important. So it's going to be the same thing. Lather up everywhere except your face and genital area. Leave the lather in place for 3 minutes and then rinse it off. And again, nothing on top of it. Don't wear deodorant or lotion to surgery. Just leave the skin clean clothes on top. As much as you're able, leave any jewelry or valuables at home. We do have a place to store things. However, when you bring any kind of valuables, there's always the chance that something can happen. And so we want to make sure that you don't have anything that you have to worry about. Make sure you take only the medications prescribed by your physician whenever you come in. Typically, this is a heart or blood pressure medicine with a small sip of water. Otherwise, no medications that morning. Get here at the time specified by the physician, and we will have a place for your family member or coach to come in with you. Coming into the hospital, you'll be able to come into the main area of the hospital, even if it's early, check in at that big front desk, and they will make sure that you get to the second floor. This is where our surgical suite is. So the pre-op nurse will take you and your coach back to a room to they'll do an assessment. They'll have you sign some consent forms, get an IV started, get your vital signs. You will have a chance to meet your anesthesia provider and, go through the plan of care for anesthesia. Be able to ask any questions that you have, make sure that you understand. Your surgeon's going to come in again and just, again, make sure that you're okay with everything, that you don't have any questions, go through everything one more time just to make sure everyone's on the same page. Speaking of making sure everyone's on the same page, everybody who comes in your room is going to ask, okay, what are we doing today and what side are we doing it on? We did not forget. This is just our way to make sure and to double check that we are all on the same page, that we are all in agreement, make sure that we prevent any errors. Now, once it's time for you to go back for surgery, your coach will have a place in the waiting room, the surgical waiting room, where they can wait, and they will take you back to the surgical suite. Now, this is typically about a 2-hour surgery, maybe a little more, maybe a little bit less, but 2 hours is a pretty good rule of thumb to say how long it's going to be. You'll have different people in there. Of course, your surgeon's going to be in there. Anesthesia provider is going to be there the entire time. They monitor you as you go through surgery to make sure that you're tolerating the anesthesia well, and they can even begin giving you medication like for nausea or pain if that's something that you need, even while you're asleep. Scrub staff, they're the ones who assist the surgeon with the surgery itself. And then every operating room has a circulating nurse. Their job is to make sure that everything's going well in the surgical room, to make sure that everyone has what they need. Now, if you're having a knee replacement done, you will likely have a drain placed. This just allows some of the excess moisture that can tend to accumulate after surgery to be pulled out. That dressing or the drain will be removed before you go home. They will apply a dressing to your knee or hip in the surgical area. And then after you're all done, you will go out to the recovery room and your surgeon will go speak to your family member. So as I mentioned, you will be in the recovery room, sometimes we call it PACU, until you're ready to be moved up to your hospital room on the 6th floor. At least 30 to 40 minutes, but it makes more sense to expect a little bit longer than that, more like 1 to 2 hours. They're going to be monitoring you as you come out of anesthesia to make sure that you are tolerating everything well, to make sure all of your vital signs stay stable, and to make sure that your pain and nausea are under control. So if you need anything for pain or nausea while you're there, your nurse will have something that they can give you. You'll be hooked up to blood pressure monitoring. They'll be monitoring your heart rates. They'll be monitoring your oxygen levels, just to make sure that you're doing well and that everything's good. You possibly will have a sore throat. Some people complain of this after they have anesthesia, but not always. So when you are ready, they will call up to, typically it's Michelle, our physical therapist on the 6th floor, and say, we're headed up with the patient. Now, Michelle will meet you at the door to your room, and she'll make sure that you're doing well, that you're not dizzy whenever you set up. But after that, she'll give you a chance to go ahead and stand after surgery and walk to, either the bathroom if you need to go to the bathroom, or walk to your bed. Once we get you back in bed or in the chair, whatever you happen to prefer, we will hook you back up to the vital sign machine. So again, with the blood pressure cuff, with the heart monitor, with the oxygen monitor, and even possibly carbon dioxide monitor. Now, I know that those things can be annoying. You've got your blood pressure cuff going off every 15 minutes. You've got that thing stuck on your finger that's just getting in the way when you're trying to do things. But the reason that we do this is if there are any kind of complications right after surgery, things like possible internal bleeding, an early sign to us that something might be happening is a change in your vital signs. So while this complication is very rare, we do want to catch it as early as possible if something happens. So our goal is to hopefully leave you on the vital sign machine for about 4 hours until we're sure that you are out of the woods for this particular complication, and then we can get you off, hopefully by bedtime. That way you can rest a little easier. Now, while you're in the hospital, we do hourly rounds, which means that someone will come check on you every hour while you're awake and every 2 hours while you're asleep. If you need something in the meantime, you do have a call light. We try to be really responsive to call light, so use that call light if you need something. So in your stay with us, you can expect a bedside shift report. This means at 7 in the morning and 7 at night, when the nursing staff are changing shifts, they will come to your room to talk about what's gone on in the previous shift, what are the expectations, and what are they looking forward to in the next shift. This gives you a chance, number one, to be kind of in charge of your care, because you can hear everything that's going on and have your chance to ask any questions and even to give any input that you might have. We like to use the whiteboard in the room for clear communication. That will have information about who your doctor is. If you have a hospitalist, their name will be up there as well. Your nurse for that shift and your aide for that shift, their names will be up there so that you always know who is taking care of you. We'll also have information about your pain control up there, and therapy typically writes what kind of assistance you might need in getting up. Now, speaking of that, we ask that you always call for assistance. Never try to get up on your own. Even if you are feeling completely balanced and completely fine, sometimes you are not quite as balanced as you feel like after a surgery like this. So even if we come in and just walk with you, we want to make sure that you're safe while you're here. We don't want there to be any chance of falling. So anytime you need to get up, please make sure you use that call light and let us help you. We'll make sure that we monitor your dressing and incision site while you're here. Any new medications that you get, we'll make sure that you know what the medication is, why you're taking it, and what possible side effects you could experience. And as far as meals are concerned, you will be able to order anything off of the menu from 6:30 in the morning to 6:30 at night, and they will bring it up to your room. Now, keep in mind, sometimes it takes a little bit for them to make the meal and get it up to you. So allow 30 minutes to an hour grace period for when they bring the meal up to you. So, if you're just feeling kind of mildly hungry, but you know that in an hour you're going to be real hungry, you can go ahead and order your food then. So it'll be there whenever you're ready. If your coach is with you, they can also order from the menu and they will bring it up to your room. That is going to be, they will need to pay for it in the room though. So that would be either $7 exact change, or they can swipe a card in the room. Now there are other options available for meals for your family member. Please contact me because these guidelines are changing, as COVID's changing. So if you contact me and you have questions about, meal planning for your coach who's going to be there with you, just contact me and I can talk with you about it. As I said, physical and occupational therapy are going to work with you starting the day of surgery, and they'll work with you every day thereafter. Respiratory therapy is going to come up and they'll bring you an incentive spirometer. This is a machine that you're going to breathe into, and it's going to help really expand your lungs, open them up, and it's going to help prevent pneumonia like we talked about. If you have had a knee replacement, you will have a polar ice machine. This looks like an ice chest connected to an ice pack. So it's almost like an ice pack that just doesn't get warm for a very long time. You will be able to take this polar ice machine home with you. So just a little tip for taking it home with you. In the hospital, we're going to be filling it up with ice and then water on top of that. That ice is going to melt so that you have a big bucket of water, which we'll have to dump out and then refill with ice and water. At home, if you will take and freeze water bottles, it can fit 4 water bottles. So if you stick the frozen water bottles in there and then put water on top of that, when the water melts, it'll melt into the bottle. So you just pull the bottles out, put new fresh bottles in there, and there is no dumping, and it's going to make your life a lot easier. So, and that's something too, that if you know that you're coming in for a knee replacement, before you come to the hospital, you can go ahead and stick 4 to 8 water bottles in your freezer so they are ready to go whenever you come home. We'll make sure that you have sequential compression devices, SCDs. You do not have to remember the name of that, but it is a sleeve that is going to hook around your calf. It's going to fill up with air so that it squeezes your calf, and then it's going to let go, and then it's going to squeeze, and then it's going to let go. Over and over, it feels a little bit like a leg massage, which is nice, but what it's really doing is it's helping your blood flow, which is going to help decrease your risk for getting a blood clot. After a surgery like this, you are going to be at an increased risk for developing blood clots. So we're going to do several things to make sure that that doesn't happen. Another one of those things is asking you to perform ankle pumps while you're in bed. This is simply as easy as moving your foot up and down while your leg's stable. It's another easy way to make sure you maintain appropriate blood flow, which is the easiest way to prevent blood clots. And then, of course, while you're here, we want to make sure that we help manage your pain. Let's talk about pain after surgery. Everyone wants to know about this. We want to make sure that we get a realistic goal for you while you're here in surgery so that we can manage your pain in a realistic manner. I tend to have 2 different camps. Some people come in and they say, you know what, it's a surgery, it's going to be awful. I can expect that I'm going to be in excruciating pain the entire time that I'm there. And then I have other people who think, hey, modern medicine is amazing. I can expect that I'm going to have no pain throughout my surgical stay or throughout my surgical process. It's somewhere in the middle. And I'll tell you why. Our main goal after you have a surgery like this is to make sure that you're getting up and working with therapy. Having a joint replacement, it's going to be so important that you maintain appropriate movement and that you continue to move. Because if you don't continue to move, the joint can have a tendency to freeze up, and we don't want that to happen. So we want to make sure you're getting up and working with therapy. Now, if your pain on that 0 to 10 pain scale, if 0 is no pain and 10 is the worst pain imaginable, if your pain is at a 10, you're going to be in way too much pain to be able to focus on anything like therapy, which is going to, defeat the purpose of what we need to do. On the other hand, with a surgical procedure like this, for me to get you all the way to no pain, likely I'm going to have to give you enough medication to completely knock you out, which again leaves you not working with therapy. So we want to be somewhere in the middle and come up with an appropriate pain goal. Now, this pain goal is going to be different for everybody. So when I talk about a goal, I mean, what can you tolerate? So if, you tell me your pain right now is at a 6, you say, maybe I can tolerate a 4. So as you and your nurse together are going to work to get whatever pain medicine you need, whatever other kind of therapies you need to make sure your pain can get down to a 4 or below. That's what we're going to shoot for. Now, this is different for everyone depending on what they can handle. Some people have a very high pain tolerance. I've heard people say, you know what, I typically am at a 10 all day. So if you can get me to an 8, I'll be fine. And then I have other people who really have a low pain tolerance and they want to be at a 2. Just keep in mind, if you're one with a lower pain tolerance, it's not just about what you can tolerate, it's also about our starting point. So if your pain is starting off at an 8, as a nurse, I can reasonably expect to give you some pain medicine and to get you down to a 5, maybe a 4 on the pain scale. I cannot expect to get you down to a 0. However, if your pain starts at a 4, I can reasonably expect to get you down to a 1 or a 0. So the pain goal is going to depend on you personally and how well you tolerate pain. And it's also going to depend on what your starting point is. Now, there's different things. Of course, we're going to have pain medication. A lot of our physicians use scheduled pain medicine, which means that around the clock, you'll be getting a small medicine. Sometimes this is, there's medicine that they use to kind of help calm nerve pain, or even something as small as a Tylenol, but getting it around the clock does help decrease your pain and help where you don't need as much of the other pain medicine. But we will have pain medicine too that you can ask for. If it's not covered by what you're given, you can let your nurse know, and they will have other medicine to give you. They should have both an oral and an IV medicine. Now, we like to start with the oral medicine for a couple of reasons. Number one, any oral medicine is going to last longer. It's going to give you longer pain control. And of course, if I'm your nurse, I want to give you the thing that's going to last you the longest. Number two, when we send you home, I can't send you home with IV pain medicine, but I can send you home with oral pain medicine. So if I'm giving you that oral pain medicine and I'm seeing that your pain is controlled with that, well, that is one of the check boxes for me that tells me that you are probably getting ready to go home. Now, we can also do things like making sure you're in the right position. Sometimes simple repositioning can help a lot with pain. We'll use ice packs. If you have the knee replacement, you'll have the polar ice. We can even use an ice pack for your hip if you feel like that's something that you need. And then even things like listening to music, meditation, and deep breathing can help distract you from the pain and actually make the pain better. And I want to encourage you to make sure you utilize the pain medicine as you need it. Don't wait until your pain gets completely unmanageable before you ask for pain medicine, because it is much easier to keep your pain controlled than it is to bring it back under control after it's gotten wildly out of control. Some of you out there like to just wait it out. I'm going to see it's not that bad yet. It's not that bad. Don't wait to the point that it gets unmanageable. We want to take it earlier because we want to keep it under control. And then number two, if we've got to the point where we have used everything that we have, we've used all the pain medicine, we've positioned you as well as we can, we've tried to use distraction, the ice therapy, and none of it's working, make sure you let us know, because we can always go back as a team and talk to the surgeon and say, hey, we've tried everything, this is not working, what can we adjust? So just keep talking to us about your pain control, and we'll do everything that we can to make sure that it's well controlled while you're here with us. Now, some other medications you can expect in the hospital are anticoagulant or antiplatelet. also known as blood thinners. Again, with the high risk for blood clots, these are going to help prevent the blood clots. Now, we're going to start you on one of these right after surgery. Sometimes it can be even something like an aspirin that you can get over the counter, or it might be Eliquis or something different. Your doctor will choose the best blood thinner for you. But we'll start you on it in the hospital, and then we'll make sure you have a prescription for it when you go home. It is going to be very important for you to get this prescription filled because you're going to be at an increased risk for blood clots even a couple of months after surgery. So your doctor is going to prescribe it to keep you covered while you're in your window for elevated risk for blood clots. We want to make sure you get that filled. If something happens and you go home and you find you can't get that medication filled, please call your surgeon's office immediately because there are other things that we can do to make sure you have what you need. We'll also start you on an antibiotic when you come in the hospital and give you one right after surgery, not necessarily because you have anything, but this will help decrease your risk of infection. If you have nausea, which can be common after anesthesia, we will make sure that you have a medication available to help decrease the nausea. So if you notice any nausea or upset stomach, make sure you let your nurse know because we do have something we can give you. You'll also likely be started on a stool softener here in the hospital. A surgery like this, plus not moving quite as much, plus extra pain medicine, these are all things that will decrease your digestion. And so we'll give you a stool softener just to make sure that's not an issue. And then we also use Nosen here in the hospital. This is a swab that you'll use for the inside of your nose, and it's going to be like an antibacterial wipe for your nose. We have found, interestingly enough, that some of those bacteria that like to cause problems, they like to colonize right inside your nose. So we will just use the Nosen to make sure that that's not an issue. And then again, as I said, when you come in, make sure that we have a list of your home medications as you're taking them now, because we want to make sure we start you back on everything while you're here in the hospital. So once we have determined that you are ready for discharge, and what we're looking for is that you can understand your post-surgical precautions. We want to know that you can get in and out of bed without assistance, that you can transfer and walk safely with an assistive device, and that you can manage your pain with the oral pain medicines. Once you check all those boxes, that is a sign to me that you are likely ready to go home and continue your progress at home. So before you leave, now this is the perfect time to have your coach with you because that coach is also an extra set of ears to make sure that they help you remember everything that we talked to you about. So at discharge, have your coach with you because your nurse is going to go through your discharge instructions. The nurse will talk to you about diet, any new medications that you have, restrictions, rest and activity, precautions. We will make sure that you have a follow-up visit with your surgeon before you leave and that you know when it is. And then they'll talk to you about taking care of your incision site and avoiding infection. Talk about taking care of your incision site because we want to avoid any kind of post-surgical infection. A post-surgical infection is a very sure way to interrupt that healing process and make it a lot longer, which of course is not what we want. When you go home, you will have a water-resistant dressing in place. This dressing is going to stay in place. Some of them will stay in place until you go see your surgeon again. Some of them will stay in place for a week, and then they will give you another one to, you'll take off the old one, and then you will apply the new one. Make sure you do that with clean hands. But your nurse will make sure you know before you leave which one you have in place. But this water-resistant dressing is nice because it's adhesive all the way around, so it's going to kind of help seal the area from anything that might try to get in. Also, the pad that sits next to your incision itself has antimicrobial properties. So it will help, make sure that nothing gets in there. Now, with all of this, I do want to make sure that I tell everyone, go ahead and treat it like you don't have anything at all in place. That's how careful I want you to be. Because while this is very, very helpful, it is not 100% infection proof. So you want to go ahead and make sure that you have clean hands anywhere you touch next to the area. You want to make sure that you don't put any kind of ointments or lotion on the skin around the area. You want to make sure that you keep this dressing clean and dry. As I said, it's water resistant, so you should be able to shower with it, no problem, but don't do anything that's going to soak it. So that would mean, hour-long showers or taking a bath or swimming or hot tubs, nothing like that. You want to make sure it stays clean and dry. When you get out of the shower, just kind of pat it dry with a clean, dry towel. Now, some things that you can do to reduce the risk of ear infection. We talked earlier about smoking and controlling your blood sugar levels. So with smoking, again, it constricts your blood vessels, so they're tiny, so that those infection fighting properties can't get through. That's going to allow an infection to flourish, which is the opposite of what we want. Blood sugar is the same way, and bacteria likes sugar just as much as we like sugar. So if your blood sugar levels are high, that's going to be almost giving food to an infection, and it's going to be a lot harder for you to heal. So make sure your blood sugar levels are controlled. Extremely limit or cut out completely any kind of smoke. You can continue nosing at home if you want to. We do sell it at the pharmacy next door to the hospital. We want to make sure you take all of your medications as ordered. And number one, most importantly, this is why I have it in bold, I have it underlined, wash your hands. Keeping your hands clean is going to be the number one thing that you can do to prevent surgical site infections. We don't think about where all our hands go, and everywhere your hand goes, everywhere you touch, you're picking up probably several different kinds of bacteria and little bugs. And if you take all of those and you stick them right next to your surgical site, you could be putting 50 to 60 different kind of bacteria just from your hands. So I encourage you, keep hand sanitizer next to your chair that you're sitting in. Sanitize as frequently as you think about it. Anytime you're up and around, stop by a sink and wash your hands with soap and water, but make sure your hands stay clean. And then more than that, just think clean. Anything next to your incision site needs to be clean. Clean hands, clean clothes, clean bed sheets. Some people tell me they sleep in a recliner. Put a sheet over the recliner, a nice clean sheet. If you have pets in the home, they do carry bacteria in their fur. So this is not the time that they need to be sleeping with you or up next to that incision site. And if you touch one of them, sanitize your hands immediately afterwards. Also, I talk about little hands. Sometimes those little hands get everywhere. So you can help your children or grandchildren, learn how to just use a little hand sanitizer on their hands, keep their hands clean. Anything next to your incision site, keep it clean. Now, all that, I also want you to know the signs and symptoms of an infection, so you know when you need to call your doctor or surgeon, because if something does happen, the faster we can get it taken care of, the better. So signs of infection are going to be a fever of 101.5 or higher. If you notice an increase in pain, a change in the color, amount, or odor of drainage, and increased swelling and redness at the incision site. Now, I always like to use an example of a cut on your hand. If you cut your hand, part of the normal healing process is there's a little bit of redness, there's a little pain involved, and you might even have some of that clear discharge coming out of it. These are all normal parts of healing. However, you also know those cuts that have gotten infected. So all of a sudden it becomes like a deeper, meaner red color. There's a lot more swelling. And now too, that discharge, maybe it's changed to a white color, maybe it's changed to a green color. So these are all signs that you have an infection. It's similar to your incision site. If you suspect any kind of infection, please call your surgeon. We want to make sure that afterwards, after your surgery, you're doing everything that you can to get the most out of your surgery as possible. So number one, that diet that we talked about before surgery, go ahead and continue that so that you're giving your body the best nutrition that it can have to heal as quickly as possible, to help maintain blood sugar levels if you have diabetes, and then even to lower your BMI overall. The less weight that you're carrying on your joint replacement, the longer it's going to last. So, if you can lose weight and be in a healthy BMI, that's just going to be better for you. We want to make sure that you know that exercise is so important to having a good outcome after surgery. It's important for hips, but I especially want to stress it for you that are having a knee replacement surgery. Your doctor could do the best surgery that he has ever done in his life. Our team could take the best care of you, but if you go home and you do not exercise and you do not work with therapy, you don't follow the therapy plan, I can promise you right now, you will not get the outcomes that you were expecting out of the surgery. This takes work from you as well. So I say it's not like coming in to having your appendix out where you just have the doctor do the work and then you rest up and you're fine. Especially with a knee replacement, it's going to take work from you after surgery to really get what you want out of this. I have had people who have had knee replacement surgeries come back afterwards and they, declined to going to therapy. They didn't really do anything. And they said, well, why is my knee not doing what it's supposed to do? You've got to make sure that you are doing the work, because I know you remember that goal we talked about earlier, that personal goal that you have. That's a good goal. It's something that we want to help you reach. but it's going to take work from you as well. It's really important to work with therapy. We'll make sure that we have that option set up with you. But they have great ideas on things that you can do whenever they're not there. They're probably going to leave you a program. You want to make sure that you're doing your therapy program when they're not there too. Want to make sure that you know things that you can do for even after you've graduated from therapy. Some exercises and lifestyle things that you can do that you enjoy, that you can keep up with, because we want to make sure that you get the most out of the surgery as possible. And keep in mind, after a joint replacement surgery, likely you will need to take antibiotics before any kind of procedure. This includes even like a small dental procedure or an eye procedure. So any physician, anyone who wants to do any kind of surgery, please make sure that they know that you have had a joint replacement surgery. And then again, for the betterment of your life, quit smoking. So just some frequently asked questions. People want to know, when can I stop using a cane or walker? And of course, all of these answers are going to depend on your personal healing process and where you are in the healing process. But good rule of thumb with cane or walker, what we're looking for is that you can walk without a limp and without pain. That way you're nice and safe whenever you go anywhere, approximately 6 weeks after surgery. So when is all the pain, swelling, and stiffness going to completely go away? It's going to go away pretty quickly for a hip replacement. A knee's going to take a little bit longer. Give it 2 to 6 months after a knee replacement before you can determine, I have gotten everything I'm going to get out of this surgery. But if you do have any questions, feel free to contact your surgeon's office and they can help you figure out if what you're experiencing is normal, if you're still having swelling, if it's normal and you just need some more time, or if there's something that needs to be done. When can I drive again? Well, this is going to depend on your healing and even what leg is involved. If you've had operation on the left leg, well, that one's not really the leg you use for driving, so it might be a little faster, but somewhere between 2 and 8 weeks. When can I go back to work? 3 to 6 weeks, depending on your job requirements. If you have a job where you can, sit down as much as you need to, then probably it's going to be a little faster than if you have a job where you're going to have to be up walking all the time. A lot of people want to know, when can they lift their grandchildren, or some, even something heavy like that. Give it 6 to 12 weeks after surgery before doing a lot of heavy lifting. Many people ask, am I going to set off alarms at the airports? Honestly, sometimes you do and sometimes you don't. They used to hand out cards that you could show that said you had a joint replacement surgery. However, they found that those cards were very easy to fake. So now if you'll just let them know as you go through the line, hey, I've had a hip replacement surgery or a knee replacement surgery, and they can get you taken care of. A lot of people want to know when they can return to gardening. Now, depending on the time of year you have the surgery done, this may or may not be a problem. But gardening specifically is a lot of up and down, bending, stooping, especially in the dirt where there's lots of bacteria. So that's not something we want to do extremely quickly after surgery. No stooping or bending for about 3 months after surgery. And then also, if you can consider any kind of modifications, like for gardening, you can always build those planter boxes so you can stand up high, no bending or stooping, no down in the dirt, and that would be fine. So if you have anything, any hobby that you like that requires bending or stooping, if you can modify it, that might be an option for you while you wait those 3 months. And then how long am I going to be involved in physical therapy? It depends on your progress, but typically somewhere between 4 and 6 weeks after being in the hospital.
My name is Michelle White. I'm a physical therapist here at TMC. I work here up on the orthopedic and general surge floor, so I typically get to see all the patients who have elective hip or knee surgeries. And there's lots of other physical therapists here at the hospital and occupational therapists as well, so you may see others as well, including me, but most of the time you will get to see me the first day, the day of surgery. I'd like to talk a little bit about what our role here is. Physical therapy and occupational therapy. We will typically come see you the day of surgery. After surgery, you'll be in the recovery room for a couple hours. Once you wake up and you're medically stable, they're going to transfer you up here to the 6th floor. At that time, the recovery nurse will give me a call so that I can meet you at the door. What we'll do is we'll have the stretcher right outside of your room in the hallway, and that's where you're going to meet us. Now, the difference between physical therapy and occupational therapy, that question comes up a lot. Physical therapy, my main focus here at the hospital is your functional mobility, ability to get in and out of bed, walk, on and off the commode, in and out of a shower, up and down stairs, general exercises to help with the increasing of the range of motion after the new joint replacement. Occupational therapy, their big focus is self-care. How are you going to be able to get your socks on and off, bathe yourself, complete your toileting tasks, do your daily grooming activities? Those activities are what they're going to be focusing on while you're here at the hospital. We try to come together to meet you for the first time so that we can ask you a lot of questions that are going to be duplicate. We're going to need to know things about your home environment, what kind of obstacles environmentally you may have, like steps or stairs or bathtubs, or if your bedroom is upstairs, downstairs, if you have a particularly tall bed or a low commode, things like those, so we can make adjustments to our plan of care so we know what you need to work on primarily while you're here at the hospital so we can get you prepared for home. So the first day when we meet you on that stretcher coming up here right after surgery, we're just going to take it nice and slow, ask you some questions about your prior level of function, what you were doing before surgery, what kind of equipment you were using, like a walker or a cane, or if you were using any other adaptive equipment. And then we're going to help you get sitting up from the stretcher. And then we will take it nice and slow. Sometimes people get dizzy or nauseous right after surgery. We understand that. We'll see what you can do. Most of the time, if we just sit for a few moments, then we're able to get up and walk. After an elective joint surgery, it's very important that you get up moving as soon as possible. We try to get you walking right away, like I said, within a couple hours after surgery. A couple reasons for that. One, research shows that by putting weights through that new prosthesis, the better your body will react to it. Two, it actually helps with pain reduction. There's a lot of there's a lot of nerve endings in the joint surfaces. So by putting weights through them, it kind of helps reset them, helps calm them down a little bit after the stress of the surgery. And the third reason is this way, if the therapy team is there to help you move for the first time, we can kind of show you some tricks, modifications, ways to do it safely. That way the nursing staff can be available to help you ambulate or move and get to and from the bathroom later on in the evening when the therapy staff's not available maybe. We would like to let them know how you're doing and how much assistance you're going to need so that they can be prepared for your level of care. So what we'll do is we'll stand if possible. Most of the time that's not a problem. And then we will walk either into the restroom or all the way into your room into the bed. The reason we stop at the door is because we've found that that's the closest to the restroom. Usually after surgery and getting pumped full of fluids and things like that, once you stand up, gravity takes hold and you need to use the restroom. That's why we park right there by the door. Not just to be mean, but just to for efficiency. Most of the time that's where people would like to stop first. After a total joint, you are allowed to put full weight 99.9% of the time. On rare occasions, there is some sort of small complication during surgery, and that may change. I will know that prior to getting you up and off of that stretcher because I will read your OR report before I even meet you. I'm going to know about you there. I will also have a walker available. We have them here on the floor, so you do not have to worry about bringing a walker from home necessarily. Sometimes it's difficult to transfer that from the pre-op into the operating room, to the recovery room, and then up here to the 6th floor. Don't feel like you have to bring your own from home. If you want yours here, just if you have a family member that can bring it, that's fine. We can adjust it and make sure it's going to fit you, but don't feel obligated to bring your own. Once we get up, we'll move, see the best you can do. Sometimes people want to actually walk in the hall because it feels good to get up. Sometimes people are ready to go straight back to bed. You may want to sit up in the recliner for a little while after surgery. All of that's fine. We'll just see how you're feeling and go from there. A couple of things. So with a knee replacement, we ask that you do not prop the knee up. So one of the things that I will do to the hospital bed is I'm going to lock out the function of the knees to lock it flat. On a hospital bed, when the head comes up, the knees automatically tent up. I'm going to lock that feature out. So the head will still come up and down, but the knees are going to stay flat. The reason for that is we don't want the knee rested in a flexed position for an extended period of time. Now, that does not mean you cannot actively bend your knee. You're welcome to bend the knee as much as you want. That is within limits of pain. That's fine. You can bend it, straighten it, move it any way you want. But I don't want it rested like with a pillow up underneath it or a towel roll up underneath it or the bed up, allowing it to be in that bent position. We want it to rest flat as much as possible because we want to get that full extension of the joint. If the knee stays bent like this, it allows fluid to get between the joint surfaces, and that can cause more difficulty with gait as we start to get up and move more, because you're going to have the fluid in between the surfaces and you can't get that leg straight to get your normal gait pattern back. So we want to avoid that if possible. The surgeons make sure that that knee bends and straightens completely while they're doing that surgery. So we want to maintain that straightness as much as possible. And we'll talk a lot more about that after surgery too. Hip precautions, that's not an issue with the hip replacements. You can have the bed any which way you would like for comfort. That's fine. We're not worried about range of motion on the hip replacement because that kind of just comes with the game. We do encourage you to try to anticipate as much mobility as possible. We want you up in the chair for your meals. Try to be up in the recliner for breakfast, lunch, and dinner if possible. We encourage you to actually use the restroom, getting up and going back and forth to the bathroom. Now, of course, we want staff to help you get up and move around in the room. Anytime you're out of bed, we want you to have a staff member with you, but we want you to just think about moving as much as possible. Right away, the first day after surgery, I encourage you to start doing something easy. Ankle pumps, moving your feet up and down. Something simple like that can actually help decrease the risk of blood clots in your legs. When you're lying still and not moving, blood has an opportunity to clot, and we definitely don't want any complications after surgery. So something simple as wiggling your feet, moving your feet up and down, that can help reduce that risk. So go ahead and do those as soon as you wake up from surgery, and then we'll talk more about that right after surgery too. So the day of surgery, we're going to talk to you a lot. Physical therapy, occupational therapy, kind of get a game plan going, find out what your plans are for your discharging. Most of the time, people are planning to go home, either with home health or outpatient physical therapy. We will kind of assess your needs at the time, but that's typically the discharge recommendations from therapy. That's about it for the first meeting. So we call that post-op day 0. The following day is when we're going to do a whole lot more therapy. Usually what will happen on post-op day 1, occupational therapy will come in the morning, help you with all your ADLs. That means activities of daily living, getting up, brush your teeth, brush your hair, go to the bathroom, getting dressed. We highly encourage you to bring your clothes, get comfortable. It's more comfortable in your own pajamas than our lovely breezy hospital gowns. For the knee replacement, you will have a dressing over your knee, an ACE wrap from mid-thigh down to your foot. You will also have a hemovac drain. It's a small little drain, a tube into your knee. So sometimes wide-legged, making sure that if you do wear pajama bottoms, they're very loose so that they can go over that dressing. Or shorts work really nicely, like the slicky shorts, kind of basketball short style. They slide well on the sheets, so it makes it easier to get in and out of bed. Hip replacements typically come straight out of surgery with a water-resistant dressing on, so it's pretty low profile. It's not real bunchy, but I would say sometimes underwear, the elastic legs of underwear is a little tight across the incision, so you may want to plan on more pajama bottoms or something like that. Now, some ladies like to wear gowns, like pajama gowns. That's fine. I would just let you know that we sometimes do group exercise class. If there's multiple people on the floor who have also had elective either knee or hips, we come into the room that I'm sitting in now and we do a group exercise session. So at times, some people feel a little modest if they're wearing a gown because we will be, moving your legs up, down, and over, around, and such. So totally up to you for comfort. We can put a sheet in your lap. If you still want to wear your gown, it's fine. I just like to make sure people are warned about that. But again, just something you're comfortable in so that you can move around, walk up and down the halls and feel comfortable. Like I just alluded to, the exercises. So occupational therapy will help get you up, get you dressed, get you ready so that we can do physical therapy exercises a little later in the morning. We try to do them about 11 o'clock. We have that time schedule set because it's before lunch, and the nurses are kind of aware of that time so that they can plan for your pain medicine accordingly. At that time, what we like to do is get any of the patients who have had an elective hip or knee, we bring them into this room. How we do that is you walk from your room as far as you can. I will follow from your room, I will follow behind with a recliner from your room and bring it here to the joint camp room. Sometimes you can make it the whole way. Sometimes people can't make it the whole way. That's also what the recliner is for. You can have a ride in a luxurious wheelchair of a recliner to come in here to the joint camp room if you're unable to make it the whole way. Or if you do make it the whole way, we'll still use the recliner to do the exercises. Most of them are going to be either sitting with your legs elevated or sitting with your feet down on the floor. We'll do some standing exercises. There's a set of stairs in here. Everybody practices the stairs, even if you tell me you don't have them in your house, because we want to make sure you're prepared for anything you might meet in the community while you're out and about recovering. The exercises usually take about 30 minutes total. I will also give you a printed handout with all the copies of the exercises that we go through, so you'll be aware of which ones I want you doing when you go home. The whole process of walking down, doing the exercises, and getting back to your rooms usually takes about an hour, depending on how many people we have participating on that day. That's why we start at 11 o'clock, hoping to be back in your room by 12, so you're ready to order your lunch and to rest for a little while. Now, with the hip replacements, those patients are typically going home that afternoon. Once we have done the exercises and you're comfortable with your home exercise program, you've done the stairs, your functional mobility, you're able to get in and out of bed, to and from the bathroom, do all those things, then the doctor is going to be ready to discharge you home that afternoon. Usually after a short report from me, making sure that we're all safe and ready to go. Knee replacements, it's 50-50. Sometimes they are going home that day after. That's our goal. But sometimes it requires an extra day. It kind of depends on pain control. That seems to be our limiting factor right now. So we're working really hard on trying to keep everybody with their pain as controlled as possible to be able to allow to do the exercises and to continue with the therapy. If you do not discharge home that afternoon, we'll still continue with the therapy. What happens then is I'll let you rest a little bit, and then I'll see you again that afternoon. Post-op day 1, I'll typically see patients 3 times if they do not discharge. If you do discharge, obviously I'll only get a chance to treat you once or twice. If you do stay overnight, then the following day, which would be post-op day 2, therapy will again start the day. Occupational therapy will be up. If you didn't get a shower on post-op day 1, you will most likely practice showering with them on post-op day 2. Sometimes with the knee replacements, there's a drain. In that drain that I mentioned earlier, it doesn't get removed until post-op day 2. So if that happens, they usually wait for the shower till after that drain is removed. So if it's removed on post-op day 1, then you'll probably shower that day. If they wait until post-op day 2 because they decide you're not going to discharge on the first day, then you'll get a shower the second day. Hip replacements do not have that drain most of the time, so that's not a limitation. Like I had mentioned earlier, you'll come out of surgery with a water-resistant dressing on, so you should be able to shower post-op day 1 with occupational therapy. Showering is one of those activities that requires a lot of energy. It's a wet surface, so and it could potentially be unsafe. That's why we're real particular about wanting to at least practice the shower transfer. Some people aren't comfortable with showering with other staff around, or with staff members in the room with you, or occupational therapy or physical therapy. Understand that modesty is an issue. We try to, that's not the point. The point is to practice the safety of it. We want to make sure you understand safe techniques so you don't go home and have a fall at home and damage any of the the good results of the surgery. So, like I said, that's pretty much almost always one of the goals of the occupational therapist to work on while you're here. If you're still here post-op day 2, like I mentioned, you'll have that shower in the morning with occupational therapy. We'll do the exercises with physical therapy, hopefully in the group setting. If for some reason you're the only patient here at that time that with an elective joint, we'll still do all the exercises, but we may just do them in your room. We'll still practice the stairs. Like I mentioned, every patient hip, knee, we always do the stairs just to make sure you're prepared for the environment. And then most likely you'll go home at the latest post-op day 2. Again, like I mentioned, home health is an option, or outpatient physical therapy, and it really just depends on your level of function and mobility, which we'll discuss with you in your comfort before you leave, and we'll help get that all arranged prior to you leaving the hospital. For the most part, that's pretty much therapy. You're going